A pharmacy benefit manager makes more money when your drug's list price goes up, not down. That is not a side effect. That is how the rebate gets calculated. The pharmacy benefit manager, the company your employer or insurer hires to negotiate drug prices, gets paid by the drug manufacturer as a percentage of that drug's list price. So when the list price rises, the rebate owed to the pharmacy benefit manager rises right along with it. Most men who have spent 30 years paying into an employer health plan assume the pharmacy benefit manager works the way a union negotiator works, extracting savings and passing them down. Every renewal letter says it. Every open enrollment packet says it. Lower cost through negotiation. The paperwork promises, and what it never mentions, is that the negotiation runs on a formula where a bigger number for the drug's price produces a bigger payment for the negotiator. This is not a rogue actor exploiting a loophole. This is the published mechanism running exactly as designed inside nearly every employer health plan in the country. What actually matters here is the gap between what the pharmacy benefit manager claims to do and what the rebate formula actually rewards, and that gap is the whole story. The pharmacy benefit manager's ability to operate this way traces back to a law that had nothing to do with drug prices. President Gerald Ford signed the Employee Retirement Income Security Act into law on September 2, 1974, a law written to stop employers from raiding and underfunding pension plans after a string of cases where workers lost retirement money they had been promised for decades. Congress built that law to protect pensions. But here's the thing, it also handed employers a federal shield. Benefits offered through a self-funded plan, including prescription drug coverage, would be governed by federal law instead of by 50 different state insurance codes. For a company with employees spread across 12 states, that federal shield meant real administrative relief, and prescription drug coverage got folded in as one more contracted benefit category, sitting right alongside dental and vision. Nobody in that 1974 room was thinking about drug rebates. The pharmacy benefit manager, at least as a rebate-driven business, did not exist yet. The rebate mechanism arrived 15 years later, and it solved a real problem. Drug prices were climbing fast enough by the late 1980s that employers needed leverage they simply did not have, and pharmacy benefit managers, which had started out as claims processing companies, found that leverage in an unlikely place. When a drug class had several similar competing brands, cholesterol drugs, blood pressure drugs, allergy medications, the pharmacy benefit manager could pick one brand for the preferred spot on the formulary and make every manufacturer in that class compete for it. The manufacturer that wanted the preferred spot paid a rebate to get it, and here's where it gets stranger. That rebate was set as a percentage of the list price the manufacturer itself had chosen. A pharmacy benefit manager negotiating harder did not just mean a bigger rebate. A manufacturer simply setting a higher list price also meant a bigger rebate, calculated off a bigger base. And none of that mattered because two decisions made 14 years apart, never designed to touch each other, a 1974 pension law providing the legal shield and a late 1980s pricing formula built inside that shield, combined into a single mechanism nobody voted on and no single person owns. The federal shield from 1974 is still the reason state governments cannot simply step in and unwind it. Most people assume this got fixed years ago or that regulators simply never noticed, and neither of those things is true. The Supreme Court ruled 8-0 in December of 2020 in Rutledge versus Pharmaceutical Care Management Association that the 1974 shield does not block every state law touching pharmacy benefit managers, a crack in a wall that had held for 46 years. Justice Sonia Sotomayor wrote that states can regulate costs and incentives without triggering federal preemption. Less than 3 years later, on August 15, 2023, the 10th Circuit read that opening narrowly and struck down Oklahoma's broader pharmacy benefit manager law, in the case PCMA versus Mulready. The Supreme Court declined to hear that case in June of 2025, which meant the narrower reading stayed in place, and as of this year, whether a state can regulate the rebate structure at all is still being decided in federal court. Not settled, not abandoned, still open. The rebate a manufacturer pays today gets calculated the same way it was in the late 1980s, off the price printed on the label, inside a legal shield built in 1974 for an entirely different reason. That shield is still standing, and the price on the label is still rising to feed it.